Welcome everyone to the 9th Annual Heritage Fair. My name's Megan Stacey. I'm the City Hall reporter at the London Free Press, and I'm going to be moderating tonight's event. We're really excited about all of the speakers and the conversations and the discussion that we're going to be having tonight. For the past 8 years, Londoners have gathered together each February to launch Ontario Heritage Week through the London Heritage Fair. And this year, of course, we've got COVID, so the Heritage Fair 2021 is online. But the focus is so applicable to our current lives. We're going to be talking about the cultural impact of pandemics. The London Heritage Council, with support from the City of London's Culture Office, is so pleased to present tonight's event, Culture Shock, the Impact of Pandemics. It's going to be an online panel featuring local experts who I will introduce shortly. You're going to love meeting and hearing from all of them tonight. So we want to start with an acknowledgement of the traditional lands we call our home. The City of London is located on the traditional lands of the Anishinaabe, Haudenosaunee, Lenapehoek, and Attawandaron peoples, on lands connected with the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. We would also like to recognize and honor the long-standing relationships with the 3 First Nations communities neighboring the City of London, the Chippewas of the Thames First Nation, Oneida Nation of the Thames, and the Munsee Delaware Nation. We've also got one of our panelists joining us tonight from Kitchener, which is part of the Haldimand Tract, the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee peoples. This territory is covered by the Upper Canada and Haldimand treaties. As settlers, we're grateful for the opportunity to gather here, although we are virtual this year, and we thank all the generations of people who have taken care of this land for thousands of years. And wherever you're joining us from tonight, we'd really encourage you to take some time to learn about the First Peoples of your region. So before we get into all the wonderful questions that you all have provided, I'm going to introduce all of our speakers, all of our panelists tonight, and read a brief bio so you know who you're getting to know and learn from tonight. So first, I'd like to welcome local historian, Hilary Bates-Neary. Hilary is a researcher and writer with a special interest in the history of London and area. She co-edited London Street Names, 100 Fascinating Londoners, and Ontario's African Canadian Heritage. And in 2015, she was named to the Mayor's New Year's honor list for contributions to heritage. Thanks so much, Hilary. We're looking forward to hearing from you tonight. Hilary described herself as the gadfly of local history, so that gives you a sense of all the knowledge there. Next, introducing Anisha Datta, Assistant Professor of Sociology at King's University College at Western University. Dr. Datta received her PhD in Sociology from the University of British Columbia. She works and publishes in the areas of social inequality, post-colonial studies, critical social theory, and South Asia studies. At King's, Dr. Datta teaches about global inequality, neoliberalism and its social impact, and critical social theory. She lives in London with her spouse and their furry companion, Joy. I don't think you have your furry companion with you tonight, Dr. Datta, but we'll hope for a Zoom bombing. Next up, we're going to welcome David Marskell, CEO of Kitchener, Ontario's THEMUSEUM. David has 12 years of experience as the Director of Marketing at the Canadian National Exhibition and 2 years at Ontario Place, where he spearheaded the successful Chinese Lantern Festival. He has just celebrated his 14th year as CEO of the museum, where he's worked hard to re-energize and rebrand the museum into what it is today. And David currently has his sights fixed on an expanded critical mass of arts and culture for downtown Kitchener. Thanks so much for joining us, David. We're so excited to learn from you tonight. And next, I'm very pleased to introduce Dr. Vivian McAlister. Dr. McAlister is a surgeon at University Hospital London and a professor of surgery at Western, where he is the director of the Office of Military Academic Medicine at the Schulich School of Medicine and Dentistry. Dr. McAlister has served in the Canadian Forces Health Services and received the Canadian Medical Association's John McRae Memorial Medal in recognition of his service. This past December, he was named an Officer of the Order of Canada, one of Canada's highest civilian honors, for his seminal contributions to and leadership in the military and civilian surgical communities as a medical practitioner, researcher, and educator. Thank you so much, Dr. McAlister. We're so excited to hear from you tonight. And welcome to Shelley McKellar, Hannah Chair in the History of Medicine with Schulich School of Medicine and Dentistry. Shelley's also Professor of History at Western University. Dr. McKellar teaches courses on the history of disease, focusing on epidemic outbreaks and social response, the history of medicine, and the medical profession. She's the curator of the Medical Artifact Collection at Western, a collection showcasing the practice and teaching of health and medicine in Southwestern Ontario. And I love this part. That allows her to play with amputation saws, tooth keys, bloodletting instruments, and more with her students. We're so excited. Hopefully we get to hear about the amputation saws, at least a little bit tonight. Thanks, Dr. McKellar. And last but not least, introducing Jonathan F. Vance, Professor and Undergraduate Chair of History at Western University. Dr. Vance teaches military history, Canadian history, and social memory, and his current research focuses on the First World War, Canadian culture, and prisoners of war. This is great. You'll love this if you don't already know. For several years, he's taught a history course entitled Zombie Apocalypse, Panic and Paranoia from the Black Death to Y2K. He's the author of many books and articles, including The Great War, From Memory to History, A History of Canadian Culture, and Building Canada, People and Projects That Shaped the Nation. Whew, okay, thank you, panelists. Welcome to all of you. Very accomplished bunch. I'm almost out of breath from that. Thanks so much for joining us this evening. And thanks to all of you out there watching our virtual event tonight. We've got some really great questions, and I know we're gonna have a really good discussion. As always, the issue will be keeping us to our time because we've got so much knowledge and so many interesting queries to get to tonight. So all of you attendees were encouraged to submit questions that you might have about past pandemics and the possible cultural impact of the pandemic that we're living through right now. I don't know about you guys, but it still feels a little bit surreal to say that and to be going through a pandemic in this lifetime. So for those of you at home, if you have questions that aren't answered by the panel, didn't have a chance to submit earlier, you can ask them in the comments on the live stream. We'll have somebody monitoring, and hopefully we'll have a period of time for that at the end of the questions that we've already got ready and lined up to get through. So let's kick it off. Hilary Neary, first question for you. Hilary, talk to us a little bit about your research and your knowledge. What sort of trends and behaviors did London experience in the 1918-1919 pandemic? And did you see any of them mimicked? Did we come full circle in this last year with the COVID-19 pandemic?
I think it's amazing how many trends and mimicry you could see between the two pandemics 100 years apart. One of the ones I identified, which is very gratifying, is the practice of voluntarism. There was so much more dependency in 1918. And my own study focused on the pandemic of 1918. I didn't get very thoroughly into what happened in London in 1919 and 1920, but certainly in 1920, there were a huge number of ordinary citizens who donated their time in various ways as auxiliary nurses, as housekeepers, preparing food for the various, for homes where, the mother was overworked or sick herself and couldn't care for the household. Nurses were given lunches that were made by volunteers. People volunteered their cars to pick up nurses and take them back and forth from the places where they were working. It was really an amazingly mobile effort to catch up where there weren't civic services and where there weren't domestic services to look after people. That was, I think, a very gratifying thing to see. I don't think that the healthcare system was as deeply organized to give the kind of care that was necessary in 1918 as it might be now. The hospital at one point, Victoria Hospital, was reluctant to take influenza patients. They were trying to concentrate only on those who had severe pneumonia. So auxiliary hospitals were set up in a couple of places in the city, and they were often organized and looked after by volunteers as well. That was an incredible way of mobilizing the care that people felt for each other. I think we've seen the same thing in COVID-19. maybe in somewhat different ways. We've seen organizations like the food bank and the soup kitchens continue to find ways of operating and looking after people who in need. We've seen people mobilized to look after the homeless, for instance. That, that's extremely gratifying. And I think one of the things that COVID-19 has certainly pointed out, and I might talk about that in some of the other questions you ask, is the discrepancy, the great economic discrepancies between the haves and the have-nots in our community, and how often volunteers are trying to remedy that, and then also bring them to the attention of the political sphere. And I really wish I knew more about how the volunteers of 1918 brought that issue to, for instance, city council. I know there were great efforts to try and coordinate the nursing care that was given across various platforms in the city, at the schools, in the municipal districts and so forth. I don't know how much the larger kind of social and economic discrepancies were also addressed politically after the pandemic. That would be a very interesting subject to explore. So that's one of the trends. There was also, I think we saw this particularly in COVID-19, the kind of blaming an outside force for the appearance of the pandemic. In last year, certainly there were rumors that some laboratory in China had let the COVID-19 escape to decimate the world. In 1918, one of the London newspapers suggested that, in fact, it was the Germans who had got a vial of the Spanish flu and spread it around the army camps. I mean, this is fake news if there ever was fake news, but nevertheless, people often want to blame and they want to fear, or at least, they need to articulate their fears. We've certainly heard during COVID-19 blaming or ascribing the origin of the COVID-19 virus to bird populations or bat populations. In London, horses were being examined to make sure that they could not pass on the what they thought then was a bacillus for of the Spanish flu. Luckily, the city veterinarians were able to dispel that particular fear. But I think people often need to have something to blame, and that was certainly a case. This is a subject that maybe Vivian will want to explore later, but there was a great deal of interest in whether or not there could be a vaccine developed that would then protect everybody. And unfortunately, science was still not quite ready to produce a vaccine against a virus, and the medical profession thought that it was a bacillus causing the Spanish flu, but there were vaccines developed. The Connaught laboratories in Toronto, amongst other centers, produced vaccines, and they were distributed to medical people in London. There was never enough produced to vaccinate everybody, but the idea was there, and I think that's another parallel that we can be happy about, certainly after 100 years. So those are some of the major themes that I saw. There was always that tension about whether you open up public places or you close them down. And there was always pushback from, say, the movie theaters in particular wanted to open faster than the city would allow them. The churches were a little more polite about coming to the city and asking that churches could be reopened. They said churches are better ventilated, we can space people out. People need the consolation of being able to attend churches. But it was mainly the movie theaters that tried to push the envelope and say, we got to get our films in, and you've got to give us warning, and we've got to get open. And so that we've seen that kind of pushback certainly in Ontario from the closure of economic centers of activity. So those are some of the trends I thought were interesting.
Yeah, absolutely. It seems like we've got the negative and the positives. We've got people rushing in to help. We definitely saw that over the last year. And then we've got the blame and the shame and the fake news. So nothing much has really changed, is what you're telling us. This is great. Okay, thank you so much for that, Hilary. Really interesting. We're going to pass it over now to Dr. McKellar. In your experience studying medical history, do we have any kind of social response to disease outbreaks, um, from the past that humans continue to revert to, that we see ourselves come back to despite new or more advanced medical practices?
Yes, I'd agree, Megan, that there is some actions that we keep seeing society come back to with every reoccurring disease outbreaks. I think we can all agree that all epidemics bring disruption and uncertainty into our lives. So maybe on different levels or scales, depending on the disease, but still, epidemics are all about disruption and uncertainty. And I think out of that disruption and uncertainty, I can think of at least three common threads or responses by society that I've seen keep reappearing regardless of the outbreak. The first is fear and anxiety. Fear and anxiety, I mean, this is a common response. It's an understandable response. And I think this fear and anxiety comes out of this uncertainty surrounding a disease outbreak. This is all about not knowing the causative agent that's causing the outbreak, not knowing how to stop the disease spread, not knowing perhaps even how to treat the people who have come down with this illness. So this fear and anxiety caused by disruption and uncertainty that epidemics bring, we keep seeing again and again. Now, Dr. McAlister and others in the medical field will say, well, a tolerance of uncertainty is a necessary skill for effective care as a doctor, as a healthcare worker. Many would argue, certainly, but I think society does not like uncertainty. Certainly not uncertainty in medicine. We in society as patients or potential patients, we don't like this not knowing, and we tend to come to expect medical science to provide answers for us. So I think it's this place of fear and anxiety that's going to really influence our actions, which brings me to, I think, another common response by society when they're faced with a disease outbreak. And that comes their willingness to entertain and go back to again and again public health measures, notably the NPIs, right? The non-pharmaceutical interventions that Hilary was referring to, right? So we all know that NPIs are the traditional tools of public health. I mean, this is all about community mitigation strategies to contain the spread of disease. So NPIs, including, say, the use of quarantine and isolation, right? And that practice, that dates back to medieval period, right? This is about protecting trade routes and make sure we monitor people's activities and movement to ensure disease doesn't come to the walls of our city. But there's other NPIs out there that we all are very familiar with now, right? So these crowd control measures like banning large gatherings and social distancing and individual barrier technologies like wearing masks or gloves, individual personal hygiene measures like washing hands, sneezing into handkerchiefs. That was a big onus during the 1918 flu, showing people how to sneeze into handkerchiefs. By 2009, the H1N1 flu, that's when we learned how to sneeze into our elbows. I remember my daughter coming home from school and teaching me that, right? So we're returning to these kind of NPI measures that seem to have worked in the past. But here's the kicker, Megan, is that when we implement these public health measures, there's these bouts of resistance. I mean, varying degrees of compliance. I agree with Hilary that we see people complying and do what they should be doing, but there's always going to be some pushback, right? So there's going to be kind of a mixed response. And some people are going to say, well, what about wearing masks? Well, yep, there were anti-maskers back in 1918. So back in 1918, they were called mask slackers. And the mask slackers, there's a pocket of them in California, and there's pockets elsewhere. They were not the majority, but they existed. And I think people were resisting against the more aggressive NPI measures that are out there, like closing schools, closing businesses, trying to limit people's movement. But here's the kicker. In 1918, these kind of NPI measures worked. And they showed the difference between two cities, St. Louis and Philadelphia. One city does it aggressively, the other does not. One city actually, St. Louis, that did aggressive NPI measures, had very low case count. Philadelphia went in the opposite direction. They worked. But then the kicker is, if they work, why don't we do them more often? Or why are NPIs, these public health measures, always seen as a last resort? Why are they a last resort if we think they work? Because, here we come, we're coming back to it, these measures are disruptive. right? These are disruptive to my life, to my pattern of life, my ability for my kid to learn, to go to school, business activity, to the economy more. And again, this disruption then feeds back into, wait for it, society's fears and anxieties. So we see kind of how they're all kind of building on each other, and these kind of threads coming back, and it comes back to this idea of uncertainty and not knowing.
I think we can all relate with the idea of uncertainty and fear over the last year. At least I can. Although I'm going to see if I can get the phrase mask slackers into a 2021 newspaper. I can't believe I didn't know that. That is a great phrase. And you talked too about, this idea and the expectation that, medicine will provide the answers for us. So we're going to go to Dr. McAlister with a question along that theme as well. Take us back, Dr. McAlister, to the Spanish flu, 1918, 1919. We're talking about what's known as the worst influenza pandemic in history. We know how eager we all are for vaccines now. What was the situation around vaccines then? Was there an effort? Was there a push to create one? And if not, was there some other kind of treatment, that medical professionals were working towards instead?
Well, the answer, I think Shelley's already and Hilary have given you correctly, that there was no vaccine, even though the concept of vaccines was well known to them, and the attempt to create a vaccine was made and actually went on for several years after the pandemic of 1918. But they had two problems. They didn't know what caused the influenza at the time. Actually, we have a bacterium called Haemophilus influenza that they thought might have been the causative organism, but probably occurred as a secondary pneumonia. And it's a mislabeled bacterium that we continue to call influenza, but it's nothing to do with flu. So the COVID-19 is actually the disease. The virus is a coronavirus, as we all know. The virus that caused the influenza, we only discovered much later to be influenza type A, and they were able to subtype it as H1N1. And that was achieved because they could dig up some frozen bodies up north that had died of influenza, and the tissues were preserved, and they were able to identify the virus in those patients who had died in 1918 and 1919. But they didn't find that out until much later. In fact, they didn't even know that there were viruses, but the scientists were clever enough to know that the particles they thought were causing this disease were smaller than bacteria. They just couldn't see them. And it wasn't until electron microscopy that came out much, much later that we actually ever saw viruses. And they didn't classify them until the late 1920s and 30s. And we didn't know, of course, until more recently that it was H1N1. So they had no chance. Now, our seasonal flu vaccines are only moderately effective. They wouldn't be very good if we had that level of effectiveness against coronavirus. We would be in serious trouble. There was an attempt to make a H1N1 vaccine back in 2009, and that they actually created a vaccine, but that epidemic or pandemic at the time disappeared too quickly for it to ever be tested. So even today, our ability to create vaccines against influenza, which they suffered, is poor. Now, this new technology, we never had a vaccine against the common cold, which is also caused by the coronavirus. But the new technology was something that was in development from the time of SARS. So we were lucky to have SARS as a preliminary, and those platforms were already in development. So it was only a question of identifying the type of coronavirus to specify the vaccine that we are now rolling out, the various vaccines that we're rolling out. So the answer in terms of vaccine, they didn't manage to have any of that. very quickly, the main measures against the influenza of 1918 were those that have been described. Basically, the non-pharmaceutical attempts to prevent disease, to prevent it spreading. Once you got the disease, you were asked not to go to the hospital because they were afraid of spreading it. And they were very reluctant to admit you to hospital. So a lot of palliative care took place at home, and people died of the disease at home. But they did have some interventions, and one that they really tried was giving aspirin. And they had aspirin, and it's believed now, they use very high doses of aspirin, far more than we would use, about 8 times or 10 times the amount of aspirin that we would use maximally today. And it's now believed that they probably did more harm than good. So if you need a parallel, it was a belief in a treatment that could have an influence that was very like hydroxychloroquine that we all believed in for about a month, and some maybe more than they should. And it probably was doing harm all along. Anyway, so they didn't have very much, but they did try nursing measures and aspirin.
It's so interesting to hear about. And I think one of the things, I don't know if we give enough credit to just the speed that we've seen, vaccine development this time around. I remember writing about that back in the early days, March and April of 2020. And, we're so eager for it, but it's pretty amazing to see how far we've come in the last 100 years. So thank you so much, Dr. McAlister. That is fascinating. I will take it easy on the aspirin for sure. So we're going to turn things over now to Dr. Vance. And I think, it was so interesting. Dr. McKellar was talking about those minutes, disruption and uncertainty. And we know that was the theme of our lives last year. And it quickly devolved into panic, at least at my house. So Dr. Vance, you teach about public panic and paranoia. With the right leadership, do you think it's possible to avoid that kind of public panic, or is that something of an inevitable stage for us when we're dealing with a pandemic or another type of public health outbreak?
Yeah, that's a really good question, Megan. I mean, I think it is possible with effective leadership, maybe not to eliminate panic, but to mitigate it, to reduce it. It all comes down to whether society has faith in their leaders. If you believe that your leaders are up to the task, then that gives you a feeling of confidence, and you can face the unknown with faith that the people who are running the ship are the best people for the job. If, on the other hand, you fear that your leaders are going to drop the ball because they've dropped the ball in the past, then you're going to be almost waiting for things to go wrong. You're not going to trust your leaders when the chips are down. You're going to trust your own instinct, and you're going to go off in your own direction. So, I mean, it can go either way. Now, history is full of situations in which inspiring leadership was able to avert panic when there probably should have been panic. For example, Queen Elizabeth I at the time of the Spanish Armada in 1588, or more recently, Winston Churchill in the summer of 1940, when Britain was facing invasion by the Nazis, and tens of thousands of German soldiers were 25 miles away from the English coast. Churchill, with his public speeches and his presence and the impression he gave, was able to project such confidence to the public that it started to seem to them that panic was inappropriate and perhaps a little bit childish. So if you can generate that sort of response, positive response in your leaders, it can do remarkable things. Now, on the other hand, there was another situation in the Second World War a few years later in California. In 1942, there was a public panic on the West Coast, panic that amounted to hysteria in places, about supposed Japanese attacks on the coast from California to Washington. And it's obvious that society at the West Coast panicked at that time because they were already doubting the ability of the US government to deal with the war. There was a feeling that the US government and the military had bungled badly on Pearl Harbor, that they had lost American possessions in the Pacific too easily, and that they simply weren't up to the task of running the country at war. And so when there was even a hint that the Japanese might be attacking California initially, people's panic went haywire. So it's an interesting situation. Now, the trickier thing now is that we as a society tend to have less faith in our political leaders than I would say we have done at almost any time in recorded history. People no longer have the respect for politicians that they used to do. Even a generation or two ago, I mean, the politicians used to be held in relatively high esteem by the public, but we know from public opinion polls beginning in the 70s into the 80s that the stature of politicians has been dropping quite dramatically in the public eye. And by the 1990s, they were among the least trusted and the least well-regarded significant people in society. And so in the past, when I think people were willing to give their leaders the benefit of the doubt that they were able and ready to do the job, now our default, I think, is to assume that the politicians are inept, they're greedy, and they're all too willing to act for political gain. However, we still crave leadership. And I think that's why we've seen the emergence of other leaders over the course of the pandemic. I'm thinking of Dr. Bonnie Henry in BC, or Dr. Theresa Tam, or Dr. Robert Strang in Nova Scotia, or even Anthony Fauci in the US. I mean, Bonnie Henry became a rock star with her own Facebook fan page because of her leadership of the province in very difficult times. So we crave that kind of figure who can inspire trust and make us, not necessarily make us believe that everything's going to be okay, because sometimes it's not, but make us understand that they know what they're doing and they're able to make tough decisions, and they're not going to lie to us. They're going to give it to us straight. I think we respond to that leadership. I think that the only other thing that comes up in this now, and we've seen this time and time again over the last year, is the impact of partisanship on anything to do with governance. So we probably would like to believe that in a time of national crisis, politicians would be above partisanship. But by the same token, we're not convinced. And I think this has undermined the public's faith in leadership. So, for example, I would probably argue that an Ontario Liberal is never going to admit that Doug Ford has done a good job, or a British Labourite is never going to admit that Boris Johnson has done a good job. Now, maybe they've both been catastrophic, but that's not how we're going to make that decision. We're not going to make the decision on its merits, but on partisan grounds. So someone's going to say, well, I'm a member of the Liberal Party of Canada, and so obviously Justin Trudeau has been a fabulous leader. And insert in that sentence whatever name and party affiliation you like. And I think the public has been dispirited, to say the least, by the politicization of pandemic responses. And that simply makes us more liable to panic. And this is why I think we've gravitated towards people like Bonnie Henry, because they're above partisanship. We can take them seriously, and we don't assume that they have some underlying motives going on. So I guess to sum that up, yes, leadership can still make a massive difference in mitigating and maybe eliminating the most serious manifestations of panic. But two things have to happen, first of all. One, leaders have to be willing to act without partisan motives, which is a big thing. And secondly, we as members of the public have to believe that our leaders are acting without partisan motives. And they're both a big ask. And I'm not sure which one of them is bigger, but I think those are the two things that stand in the way of leaders in times of pandemic.
Could I add my own rule, which is no tropical vacations while we're stuck at home? I think it's a reasonable expectation. I do.
Well, I mean, I know exactly why you say that, and I mean, on a that has impact on an emotional level, but on a rational level, you think, yeah, they shouldn't have been able to do that. But then you think they weren't smart enough to realize that someone was going to call them on that. That's what really offends me, that they think they're going to get away with it. They think, I don't know. Don't get me started, Megan. Do not get me started on that.
I shouldn't have. I promised I wouldn't get in the way here. But you know, I think it's so interesting. You're talking about this idea of undermining that public confidence, right? And do we feel that our leaders are going through what we're going through in a way, you know? And I wanted to pose a question like that to Dr. Datta as well. You know, we hear the phrase so often that we're all in the same boat, right? We're all fighting this storm together, this COVID-19 wave. But I think it's fairly clear. We all know now that the pandemic does not impact everybody equally, and you know we're not fighting the same storm, or at least we're not all in the same kind of boat. Do you think that we or societies of the future will be able to learn from this pandemic to be more socially accountable, or to even out those disproportionate impacts? Talk to us a little bit about what we're seeing with COVID-19.
Yeah, I mean, definitely we can anticipate that there would be more pandemics, even with more virulent, strengths and all that. So at this point, right, standing at this point, what should we, what should we do better, right, next time? So what really first comes to my mind, living in Canada during the pandemic, especially last year, was the disaster that happened in for-profit long-term care homes. And the care workers, right, low-wage care workers without benefits often and in precarious work conditions, how they were trying to help our seniors, right? So definitely, like we are, like somebody said, though we are facing the same storm, but pandemic affects different groups of people, right? Sometimes based on biology, like age and pre-existing conditions, but then also on social factors, right? So one important thing that comes to my mind, drawing reference to the SARS pandemic, right? That so much didn't affect North America. There were traces in BC and all that, but Southeast Asia to a great extent. Is that our generational social consciousness hopefully should keep in mind what ecologists have been saying for a long time, that our greed and aspiration could be infinite, but ecology, Mother Nature, and Earth's carrying capacity is ultimately finite, right? So just quickly, to go back to that SARS incident, pandemic, there was, like research shows now that because wetland was being degraded and it destroyed, because there was rapid development in industrial agriculture, industrial livestock farming, and because of that, migratory birds interacted with domestic ducks and poultry, and that helped to that kind of led to jumping of that virus. And so one definite thing that should be made, should be brought in now at this stage is that we should have a globally coordinated pandemic surveillance or pandemic monitoring system, right? And there should be international bodies which have more teeth, because we have seen in the past organizations like UN and WHO, sometimes they do not have that power, sometimes they do not have that teeth to to make countries implement different measures, right? So one thing could be that when research shows that animal wet markets, unless they are regulated well, are very unsafe and can lead to this kind of virus jumping species and all that. There should be a global level coordination, right? Listening to experts and all that. The other thing that comes to my mind when it comes to social accountability, right? Putting pressure on government and through democratic voices, is that big pharma, we have seen, have neglected vaccine production. Instead, they're more inclined towards producing profit-making chronic disease medicines, such as medicines for our diabetes and blood pressure and all that, right? Or even nail fungus instead of basic vaccine, right? And there's an economic logic to it. So I think there should be big pharma who earn in billions, right? Like information technology today, biotech companies are the big profit-making sectors, right? So they should be made accountable, right? That they should put more funding into vaccine production, vaccine research, right? So that, of course, it was done quickly, as Dr. McAlister, again, because the platform existed for SARS. But research again shows from 21st century that just 11% of resources are spent on research by big pharma, and or almost like close to 27% is spent on marketing and sales, right? So, and no wonder that CEOs of big pharma are people who are not scientists, but they are people with MBAs and marketing and sales background, right? No wonder there. So the other thing that I think we should ask our policymakers, politicians, and of course, living in a democracy, we have that voice through free press and all that. That today, just like when in 19th century, early 20th century, when countries faced famines, droughts, right, and food insecurity, so countries made an effort to become food grain, that countries wanted to develop food self-sufficiency, right? Like I was wondering how come Canada doesn't have a vaccine manufacturing facility, right? UK was zero, but it suddenly pivoted and started manufacturing, right? Again, there is an economic logic. Developing countries such as India, China are more into vaccine production because the profit margin is less for this big pharma, right? Cost of production, etc. I don't need to get into the the globalization and the economic part of it, but I think countries, developed countries, rich countries should also make an effort to become vaccine self-sufficient, right? So I think that is another big point that we should keep in mind as a global society. And lastly, I would like to point out that in this crisis, long-term care homes, our seniors, our care workers, right, who do backbending job, and they are often from vulnerable groups, right, and all that. Care work is not valued in our culture and society, right? Care work is not valued in our culture society. On top of that, in our very consumption-driven, fast culture in North America, we tend to value more. We tend to have put more value on youth, money making, productivity, and perhaps that makes me wonder: is it one of the reasons that with our seniors, that government policymakers could let that happen, right? Especially, it has been clearly shown that more deaths and more negligence were present in for-profit LTCs, right, compared to the public funded ones, right? So do we need to get into a public debate that just like our healthcare and education, should our LTCs, long-term care homes, should come under the public umbrella, right? So that's a debate. Or if we cannot get into that, how to make our for-profit LTCs, right, more accountable. And as I was trying to tell you, care work, which is of course disproportionately done by women, right? And there, sociologically, we know there is something called feminization of work, leading to feminization of poverty and all that. So I think at this point, right, having gone through the whole, pandemic crisis and all that, we should I think we should learn to value care work, right? Value care work, and also keep in mind that if we have to recognize care workers' dignity, right, we should think about how to make them earn a living wage, not just low wage. How to make them earn benefits that, you know, we white collar professionals take it for granted, like paid sick leave. Now, right now, there's a debate surrounding it. Some people point out that, you know, some people take advantage of it. But again, research shows only a, you know, minuscule percentage people take advantage of it. So should we care about those things? And I think, you know, putting focus on marginalized groups, right? Low income earners, our care workers who do such vital work, right? I think these are some of the, you know, concerns which should dawn on us as how to become more socially accountable.
You know, in a way, it amazes me how short our memory and our attention span is, right? Whether, as you say, it's the vaccine production or something like appreciating our essential workers. You know, we're all too eager to look to where's my vaccine, or, you know, heroes or hero workers. And, you know, are we going to carry that forward once this is done? We've seen it go, as you say, in waves, right? No appreciation until we're in the heart of it. It's just, it's interesting. We don't learn. I hope we learn this time.
Yeah.
But thank you so much, Dr. Datta. That was great. And hopefully David hasn't left us, because the next one is coming to you, sir. You know, speaking too of our memories and keeping these things in our mind, even past our COVID window and our COVID bubble. You know, we know that we understand our past pandemics because information, experiences, and artifacts were preserved. Can you speak to the role that museums and cultural institutions are playing in capturing and preserving this pandemic for the next generation and ones beyond that?
Thank you very much for including me, and for me coming all the way down here to London. Traffic was great, so that was made the trip much easier. So again, thank you for involving me. Our museum is quite unique, and we don't have a collections. We're not really a collecting museum, but one rather about experiences. But we have done a few things that align with the future and how people can look back. One result is our youth council. They've decided to pivot their initial project to collecting stories of youth in our community in order to curate and develop a documentary exhibition on COVID-19 and the impact on youth in Waterloo Region. They're currently working on this project, and hopefully it will premiere in a couple of months. And it's a great opportunity for them to create something impactful and also gain skills that they can utilize in the future. So I'm very excited about that particular project, about the youth capturing what it's been like for them to live through this and so on. Another great project we've supported is called From Behind the Mask. And I'm not sure if London has a similar project around community quilt making. And we've held workshops where the community has been invited to contribute to a large community quilt based on the form of the mask. And just by the way, hashtag mask slackers. I love that. I can't wait to read your story, Megan, and I'll be pushing that out. But each piece of the quilt captures whatever one wants related to the pandemic, and it's so many have been impacted differently, obviously, and some very tragically. So we're really pleased with that project and working with the organizers so that we can display the quilt at some point in the future. And through our programming efforts and exhibitions, I feel that we can and should prepare society for changes in the future. And some of the speakers have alluded to this is going to happen again, and we need to be prepared for that. And I think that telling the stories so we don't forget them, and especially coming from the youth, I think that one's really key. Some of the collecting museums, they're going at this, their mandate is along the lines of collecting. And so they will be, and I know it's called the Ken Sealing Waterloo Region Museum. they have put a call out for stories and different artifacts from the pandemic. And so I can imagine that will become part of their permanent collection for people to see in the future.
This is great. I'm so looking forward to watching that, view from the youth. I mean, I think it's impacting everybody, but when you talk about our young people, I mean, they've given up a lot too. So it'll be so interesting to hear from their voice. Thanks so much for that, David. Really appreciate it. Next, we're going to go to Dr. McKellar. So Dr. McKellar, you study the history of disease, focusing on epidemic outbreaks and social response too. So in your research, have you found similar trends across pandemics and across outbreaks, throughout our history? What sort of common threads are we seeing?
Well, there's lots of actually trends that keep appearing that I can pick out different disease outbreaks and connections. And my students love that compare and contrast. And they're always surprised when they find out that our current experiences, we've seen this before. And I'm going to maybe give a shout out to 3 trends that a lot of the students can actually get behind. And the first trend that we're all familiar with is the panic and neglect cycle, right? So the panic and neglect cycle, that's almost every kind of outbreak experience. So the first part of that cycle is what's happening right now to us, right, with the COVID pandemic. So we're in panic mode right now. So it's the crap, what do we do now? Maybe this virus will go away soon and it'll just be a short episode. Oh, nope, it's not. Crap, what are we going to do? That didn't happen. People keep dying. Businesses are failing. Crap, can't the government do more? Okay, great. We have a vaccine now. Oh, crap, why doesn't Canada have its own domestic vaccine manufacturing ability, right, Dr. Datta? Can't the government do more to get vaccines here and to hurry up this vaccine roll up? So you get a sense of it. We're in this panic part of the cycle. The second part of the cycle happens after the pandemic is over. So it's the pandemic is old news now. It's over. I've discussed it enough. Just let's get on with it. I just want to return to normal. And we saw that in 2003 after SARS. We saw this again in 2009 after the H1N1 pandemic. And by the way, I asked several of my friends how they navigated the 2009 H1N1 pandemic for a lecture I was preparing for my students. And my friends couldn't remember if they had received the H1N1 vaccine or not. I'm like, how is that possible? And by the way, only 40% of Canadians actually lined up for the free H1N1 vaccine during our government's mass immunization program, the fall of 2009. So I'm fearful with our current COVID-19 pandemic that we're going to fall into this panic and neglect cycle. So that's one trend in history that you can pick out all the time. Another trend is, and Dr. Vance is going to love this, is war analogies. War analogies. There's a trend for the use of war analogies to fight disease outbreaks. So we have fought wars on, battled against, targeted the enemy and more against multiple infectious diseases. And you could pick some out, the war on polio, the fight against tuberculosis, diphtheria, and more. And you kind of get that, right? That this is understandable. And we saw this with COVID in April, May of 2020, that there's this war language being used to describe COVID. That's kind of the disease narrative at play. So it's understandable. We can make sense of this, the language of fighting, battling, beating, winning against this invisible enemy, right? And this is all very useful to mobilize resources, mobilize people, getting people to buy in, give them objective, bring people together. We're all part of a team here and we're going to win, right? The outcome that we all want. We want to win. We want to win. We want to get to the end of the pandemic. And then another trend that I think you've touched upon already, Megan, is this, and this is very much a 20th century trend, is this very demonstrable faith in science as the way forward to ending a disease outbreak. So NPIs aside, the non-pharmaceutical interventions, put those aside, but there's this faith in science as a way to find answers, both disease etiology answers, but also how to screen for the disease, how to treat the disease, and dare say a cure for the disease, right? That science is going to be the exit strategy for any pandemic, just as we are now hoping, believing, cheering for, right, that the vaccine is going to be our exit strategy out of this COVID pandemic. So those are at least 3 trends. Oh, and let me ask, I'll add a last trend, pandemics end. pandemics end, right? And typically there are two types of endings, right? There's a medical end and a social end. So a medical end occurs when the incidence and death rates all decline, right? They plummet. And the social end occurs when the epidemic of fear about the disease is on the decline. And I think we're on track for a medical end, a vaccine-induced medical end to the COVID pandemic, but I'll leave that to the medical specialists. I'll leave that to Dr. McAlister.
Well, I have to say, I'm so glad that the medical professionals in the room can't always recall with exact certainty some of our previous pandemics and the response, because I lived through that too. And when we started to realize what 2020 was going to look like, I thought, really, like SARS? I don't remember any of this. So it's good to know that I don't think I lined up for my vaccine either. I don't know about that one. So, and you talked too about the social end, right? Or we hope we're going to get to both the medical end and the social end. We know we will eventually, but Dr. Datta, wanted to pose another question to you. We've seen so much widespread change over the last 11 months, almost a year now, to our everyday lives. Do you have any predictions about the long-term societal, social changes that might come from this pandemic once we do reach those ends, hopefully soon?
Yeah, this question, of course, would require a little more, speculation. But still, there is one fact that really fascinated me. I was doing some research, and something that disappeared after the 1918 influenza in places like North America was the spittoon. Right? It used to be available easily at restaurants and public places. Right? You spit into it. But after that pandemic, it was seen as socially irresponsible and danger to public health, right? And that you'd have that, right? So it vanished. So that makes me think that perhaps in post-COVID time, one generational consciousness that might dawn on us would be most likely, the cultural practice of handshaking and hugging might wane. But thankfully, in our globally connected multicultural context, we have the East Asian bow or the namaste, right, to greet each other. So that is something on a lighter note. But I think one thing I believe that would become more acceptable and normal is the use of face mask, right? Wearing a face mask, right, typically in our culture is seen, suspicious. But plus it was seen as a sign of unfreedom, right? Government intervention, right? We know that, especially happening big time in our southern, beyond our southern border and all that. But I think wearing a mask to cover your face, so that infectious droplets don't infect somebody else, might be seen increasingly as socially responsible role, a role that you care more for public health, for public, right? You are a more public oriented person. Thirdly, what has already been is coming up in data is that women's labor force participation was suffering, right? Now we all know, right, across the world and more so in North America, that with long years of struggle, women could get access to formal education, paid jobs, and many other things, right? To to be recognized as half of world population and all that. So there is one can speculate, and again, certain these kind of patterns have also happened during the war. That perhaps when in the post-pandemic recovery time, when economy is suffering, is not healthy enough, and there are dearth of well-paid good jobs, etc. Maybe among heterosexual couples, they might mutually make a decision that let the man work outside in paid employment and let the wife take care of housework and kids and all that, raising kids. Now the question remains, if that happens, are we going backward, right? Given the history of women's struggle, right, to gain access to employment, education, political rights, and many other things. The third is, which is we are doing right now. we are all sitting at our homes, and we are getting business done, right? So remote work, again, the catalytic force of this ICT, great technology, platforms like Zoom, Microsoft Team and all that, right? New discoveries of 21st century. That would, of course, that has made remote work more convincing, right? People used to doubt, right? Would my worker be sincere enough when they are working from home and all that? Wouldn't they pay more attention to what is burning on the stovetop, or why my kid is yelling in the other room and all that, right? So definitely remote work become more convincing, right? That people can get things done. And that can also trigger less international travel, right? Air travel, right? Who knows? Budget airlines might go on a decline, right? Who knows that people might, and that trend is already happening, we know, in places like Vancouver, Toronto, people with more disposable income, that they might want to live outside the packed, densely populated city centers, right? Now, again, that can lead to less commute, less air travel. That can help the climate, our climate, but that can also be good in the sense, in our busy time, in our fast-paced life, 21st century life, we are so work focused, we do not always spend time with our family, our loved ones. So maybe I do not have to go to Kyoto, Japan for that international conference. I can, prepare my paper and read it over Zoom, and it's all done, right? And I can also have, great interaction over Zoom with my, like-minded researchers and all that. The other thing, which is actually, I was thinking just over the last few days, what happened, the fiasco that happened at Wall Street, with the easy availability of, apps such as Robinhood, right, for retail investment, right? More people, especially in the last year, a record number of people have joined retail investment using these kind of smartphone-based apps like Robinhood, right? You know what had happened, right, at Wall Street with short selling of some of the stocks, right? So GameStop, etc., surged. People didn't know why it's surging and all that. Of course, it led to some debacles, somebody losing his life, then some people losing millions of bucks and all that. It is also being positioned as big Wall Street versus all these small time investors. But my point here is this, because like I've been doing a lot of research about neoliberalism and how neoliberal policies have cut jobs, have made our millennial generation more insecure in terms of finding they are just they have to be happy just finding gig jobs, right? Flexible jobs, contract based, driving Uber and all that. So I believe there would be a trend, because I didn't have age divided data on how many people are new into retail investment through apps. But I believe millennials who are sitting at home, not having a good job right after their degree, and they have their smartphone, they can easily download Robinhood app, and they might be more into this kind of investment, retail investment. Now that can lead to volatility of the market, right? Is that good? Is that bad? We have to see. And lastly, I would like to point out, just to be within the time frame, that I think after this pandemic, after all these rhetorics about it's the China virus, yeah, and it is this and that, right? A lot of animosity, a lot of conflict kind of positioning has been done, right? Partisanship created by politicians, as Dr. Vance was pointing out, right? So I think if we develop a kind of generational social consciousness, right, post this COVID pandemic, perhaps we should pay more attention.
What a time. What a time for a freeze. We should pay more attention. We are paying attention, Dr. Datta, I promise. All right, hopefully she's going to come back and join us soon, because I really wanted to ask a question. All right. Hopefully that'll just be a little frozen blip. It was so interesting. Dr. Datta talked about the spit tube, and I want to know if birthday cakes and blowing out the candles is going to be the 2020 the new age spit tube. I never realized how weird that was until the past year. But okay, I've stalled a little, and I don't think Dr. Datta is going to rejoin us, hopefully for the next question. So let's move on to the next one. This is for you, Hilary. We're going to look back now at the Spanish influenza in London in 1918. Talk to us a little bit about the role that London's status as a military center played in the spread of disease.
Okay, I'm here. Well, of course, London had the big military base. It was the head of the military district #1 in Canada, and it had the military base at what was called Carling Heights, where Wolseley Barracks now is at at Adelaide and Oxford Street area, and with a sizable number of men. Now, some of the first outbreaks in London occurred when members of the Western Ontario, it was a band, it was a Western Ontario regimental band, went out of town and came back. There were about 8 guys, and they came back, and some of them very quickly came down with the Spanish flu. Now, the military had very tight arrangements for quarantining those who became ill, and I think that was a very important aspect of how they were able to maybe not exactly control it, because the numbers did eventually shoot up at the barracks. But I think they were probably more cautious about letting the men out into the general populace. Eventually they were banned from going to any public gathering. So there must have been much tighter controls over the movement of the men who were stationed in London in terms of spreading the Spanish flu to the general populace. But I think it showed how easy it was, and we've sort of seen this in COVID terms, how easy it was to move the virus from one place to another. And certainly in the broader area of Canada, if you look at how the Spanish flu spread in other parts of Canada, many of the spread was attributable to troop movements. There were troops sent to the West Coast. They went to Siberia to serve in Russia, and the pandemic moved along the train route with them. There were Polish troops stationed in Niagara-on-the-Lake for training purposes, and they came down with it. At one point, there were Chinese gentlemen sent to France to help with infrastructure work. I'm sure it was very poor work. And they went across Canada and in boxcars, and they ended up in France with suffering from the pandemic. So I think the military, I can't say they were responsible, but just the general movement of people often meant that the pandemic moved with them. I think, however, that what was done at Wolseley Barracks was an example of how if you quarantine people quickly and you restrict their movements, then the pandemic might not necessarily spread as quickly. And this was also the case at the mental hospital in London, which had something like 1,000 patients in 1918. And whenever someone got sick there, they were very strictly quarantined. Now, these people would not have had great freedom of movement, so there wasn't the danger of them moving into the community, but just the quarantining meant that even visitors wouldn't be able to spread. So I think that it was a narrow experience, but it was a very important one in terms of understanding, particularly quarantining. So there's a short answer.
If I can just take 1 second, I'm so sorry. My internet connection suddenly sapped, but
Nope.
that was my last point. As I was trying to explain to you that I hope like the last point was clear. I'm so sorry. It never happens, but then again, it happens, right? Murphy's
I
Law.
apologize. I'm supposed to be tracking all of your answers, and that was my secret way to just end the point. We were over 5 minutes, so I kicked the server out.
Great. Thank you. Thank you. No problem.
Just kidding, just kidding. And we've got Dr. McAlister back with us as well. So welcome back, everybody. We got the crew here. And next question's for you, so good timing. Can you talk to us a little bit, Dr. McAlister, about why there was such a high mortality rate during the 1919 pandemic among those aged 20 to 40? You know, those people that we would typically think of as a pretty healthy portion of the population.
Yes, that's a major difference between 1918 and the current pandemic. As we mentioned, it's a different virus. They're both contagious respiratory viruses, so they do cause very similar diseases, but they actually affect the person slightly differently. The viruses can cause two types of effect on the body, detrimental effects. The first is if it damages the airways, so you start coughing and wheezing and bringing up sputum. That's kind of direct damage. The second response is the immune response to try and kill the virus. And that response is an effort to eliminate the virus from your body. But all of our respiratory viruses have different characters of how much they cause it. So H1N1, which was the virus that caused the 1918 influenza, has this ability to induce an immune response in the person that overwhelms the body. And that's why young people who were, even the fitter young people, were the ones who were more liable to get the severe response. The other response where it damages the airway, the coronavirus is much better at doing that. It damages the airways and makes you very sick and makes it difficult to breathe. And it does cause an immune response as well, but nothing like as bad as the H1N1. The other thing that we found with the 2009, you know, that we had the 1918 epidemic, and we reckon we had at least 3 other episodes with the same virus up to 2009. And during the 2009 epidemic, it was noticed that pregnant women and Mexican people were severe response. And it's never been fully analyzed, but one of the things that happens during pregnancy is that you change your immune response to try and protect the baby in the uterus. And instead of having the severe immune response that would throw out the virus, you actually develop what's called a type 2 immune response. And interestingly, indigenous people also tend to make that type 2 response more frequently than European Caucasians. So as a consequence, they can get this more severe response where young, fit people are overwhelmed with the immune response and die. And that was one of the features of the 1918 epidemic. It was well known that, you know, you might have a missionary or a visitor to an Inuit village and the entire village would die as a consequence of that single visit, which was a far more severe response than was seen down south. And it may have something to do with the way our bodies respond to the virus. So that's a complicated answer to why the young people died in the 1918 epidemic in comparison today. Today, you know, we still see it. We still see some young people get that severe response to the coronavirus, and they get an overwhelming immune response and are very difficult to save. But we do have medicines to interfere with it now. And one of the ones that has been proven useful is steroids. So giving us a short dose of dexamethasone, which is a very powerful steroid, can interfere with that immune response. Of course, that wasn't available to them in 1918, and they were trying aspirin as an anti-inflammatory. It was the best thing they had, and it unfortunately doesn't work. But they knew what they were doing, but they didn't have medicines against it. So a second thing that makes us better is that we do have medicines to interfere with some of those immune responses. And then the last thing we have today is that if you do get overwhelmed with an immune response and you can't breathe, we can use ventilation with oxygen. And that wasn't available in 1918. So if you got to that state, you would die. I think if we had the same amount of material support as they had in 1918, we might see a slightly different pattern and wouldn't be really asking the question, why is it different to 1918 today? So a lot of it is treatments that are available. Thank you for that.
Oh, frankly, it's scary to think about, you know, if we didn't have, and I understand that that steroid you mentioned is actually one of the cheapest and or relatively inexpensive and widely available too. So you compare that to, you know, trying to have the same response with I think you said 8 to 10 times the amount of aspirin we'd use today. I'm sure glad we go the steroid route now instead of the aspirin, overdoing the aspirin. So we're going to turn the next question over to Dr. Vance. Dr. Vance, do you think that, you know, our unlimited access to news, to information, to social media, does that create any higher level of paranoia or panic compared to what we've seen in past pandemics?
Oh, I would say definitely. So I guess there, Megan, you're part of the problem. You and
I
the
was
news.
going to say, now, no bringing the free press into this.
Yeah, I think that's a really good question. It's very true. I think we need a break from news to be able to process what we're hearing. We need time to reflect, to think to ourselves, well, is that something I really need to worry about? Should I panic? Is it okay? Now, in the olden days, and I use the term olden advisedly, you would read your newspaper in the morning. You'd have all day to think about the stories, to decide whether they were worth getting freaked out about. Or just as important, you would have all day not to think about the stories. You would have all day to avoid thinking about the news and to get on with your life. And that time, I think, allowed you to put things in perspective. You could sort out what you were learning and arrange them in your head in a kind of hierarchy of importance, if you like. What we see today, when you have unlimited access to news every hour of the day, is that we don't have time for that reflection. There's not time to actually think about the news that's going into our head. So you read a news item and you start thinking about it, and you're trying to process it, and then there's another one coming, and there's another one coming, and another one. So our circuits are, in a sense, getting overloaded, I think, by that process. Instead of us having the time to wonder whether we should panic, simplest thing is just to go right into panic mode, because we don't have the time to decide one way or the other. Now, I would hasten to add that I'm not just being a cranky old person and saying that newspapers were better than social media news, although I think they were. There's actually the science to back this up, because there's been a lot of studies done on the impact of getting your information in different ways and how that affects your tendency to panic. So, for example, in 2018, there was a huge study at MIT that looked at, I think, 4.5 million tweets about 125,000 news stories. And the conclusion was that false information was retweeted more quickly and to more people than true information. The truth took 6 times as long to reach their target figure as lies. And lies were 10 times more likely to reach a big audience than truths were. And their conclusion was that this was simply because in this constant quest for online news, untrue stories were more likely to generate emotions like fear, disgust, anger, irritation. And people are a sad commentary on a human condition, people were more likely to pass on those stories than they were to pass on stories that were positive in nature. So this puts our addiction to social media news into a different light. The speed with which we pass on news without actually thinking about the impact of what's happening now. Fortunately, Winston Churchill predicted this decades ago when he said very famously, a lie can get halfway around the world before the truth gets out of bed. We're seeing that on social media coming true in many ways. The second study, which relates really interestingly to the first one, demonstrates that the way you acquire news affects your level of panic. As I say, this feeds into the MIT study. There's a University in California, Chapman University, that for many years has been doing a study, multi-year study of fear in the United States, and they've got massive amounts of data on people's fear responses, what motivates it, and they can break it up into all sorts of different variables and find which social characteristics are likely to create more fear or whatever. And one of the things they've looked at is how people get their news and how that relates to how frightened they are. And what they found is that people who, according to the surveys, say that they get their news primarily from daily newspapers, reading daily newspapers in hard copy, tend to have the lowest level of fear. People who get their daily news from watching television have network television, I should say, like CBC or CTV, have a slightly higher level of fear. People who get their news primarily from watching news networks, 24-hour news stations like CNN or Newsnet or Fox News, have a significantly higher level of fear. And the people who get their news primarily from social media news outlets, talk radio, podcasts, that sort of thing online, have a much higher level of fear as compared to everyone else. Not only do they fear more things, but they fear things more intensely. So I think that's a really interesting result. The fact that the way your constant access to news, people who take advantage of news more frequently tend to be more frightened. And people who don't have a much more stable relationship with the world around them. As the Chapman University study put it, they said, what was it? The slow news is good news, is the way they put it. And so the answer to your question is, I would say an emphatic yes. We would all be far better off if we weren't able to check the news headlines every second of the day, or if we didn't feel that we should check the news headlines every second of the day. Those two go together, I think.
I would just like it to be very clear that in no way did I ask or pay for that endorsement of newspapers, not at all. I happen to agree with you, Dr. Vance, but no affiliation here. I had no idea he was going to say that.
Purely coincidental, purely coincidental.
Absolutely. You know, it's funny. My partner is also in the news business. And so sometimes we're talking to our friends who are blissfully unaware of the day's COVID numbers or, you know, even sometimes big news events. And we just look at each other and think, what? How could that be? People just go on living their lives without checking Twitter every moment and following every second of news. But there's got to be a happy medium in there.
Yeah, it's amazing how easily your life can go on if you don't check the headlines every 3 minutes.
That's right. I need to learn that. I need to learn a little bit of that.
Yeah.
This is great. Thank you so much for that, Dr. Vance. I have a lot of questions and comments, but I know this isn't about me or newspapers, so we'll move on to the next, which is a question for David. And I'm really interested in the answer to this one because I know my personal thoughts. We hear so often people talk about, the cultural boom of the 20s after the devastation of World War I and the Spanish flu. Do you think we will have anything like the Roaring 20s after this pandemic? Are we all going to rush out to our parties and our fancy dresses?
Learn how to do that. There, we did it. I absolutely think we will have the Roaring 20s. It's already happening, like in places that have opened in Wuhan and China, like people are going back to movie theaters, they're on the streets, they're out. Australia. It never stopped in the United States. Like once we hit the green code, I think people will be running out faster than my dog used to fly between my legs if there was a door left open. Humans are social creatures, and I believe we will get back to the normalcy of shaking hands and hugging will return. Spitting certainly made a comeback, at least in the NHL. I just think that we will get back to a lot of what we take as normal. I believe there's a need, a desire, a thirst for us to socialize right now. We're pent up, and I think that this is where museums can play an important part, and those cultural centers can play an important part. One thing that may change, Anisha touched on this, is that people may start to work from home 2 days a week. That means they're home 4 days a week. That means they're with their wife more than they're with their colleagues at work. And I used to be with my colleagues a lot more than I was at home. And you would have a coffee with them or walk down the street for lunch or what have you. And I just think that that will make a need for even further socializing, and that places like museums and cultural organizations will help knit the community back together. They'll become places for gatherings. And but I do believe 100% that the Roaring '20s will hit and happen quickly. I also have a bit of a fear that universities may lose their status as geography is weakened. And I know that some first-year university students may want to live life in a dorm, but others have come through a year of studies, and maybe some of them have found it wasn't that bad. It was certainly less expensive than having to pay for rental accommodation. And that could lead to students considering courses anywhere in the world. They don't have to leave home. They could go to Australia or MIT. And that means that communities will not only be in competition for skilled workers, but increasingly for students. And I think that's an interesting one as geography is weakened. And that, again, is where I feel the quality of life and the arts scenes play a critical role for a vibrant community and to attract those students and skilled workers. But yep, Roaring '20s, I'll see you out there.
Going to be great. I can't wait, except I think we should all just agree on earlier bedtimes. Let's just have all the gatherings start earlier in the afternoon. We can enjoy and all be home early. So thank you so much, David. That's great. And I am particularly pleased to know or to think that hugs and handshakes might return. So we're going to go to Hilary for the next question. We're shifting gears a little bit here, but Hilary, talking a little bit about how previous health crises, something like tuberculosis, has affected domestic design in the latter part of the 19th century, one example being sleeping porches. Do you think that COVID-19 will have any similar effect in design when we're looking at new buildings or spaces? Will we see those marks from this pandemic?
I think so. I think very much, I'm thinking of what David has just said. I think there are going to be many implications for the arts, and architecture is certainly one of the ones that very much affects how we live. And I think back to the 1918 pandemic in London, for instance, as to how it awoke the consciousness in many possibly more privileged citizens of the city, as to how the people who were maybe living in more economically disadvantaged areas of the city, the kind of housing that they were in, where often there would be very inadequate facilities for keeping things clean. After the pandemic, I was looking today and I couldn't find it, but there was an incredible number of domestic homes in London in that period that still had outdoor privies. And this meant, a completely different kind of life. I think that must have changed very much in the 20s and 30s. And I would like to meet an architectural historian who knew how that impact changed in London. But I think that one of the things that pandemics does is it does make us aware of the inequities, the social and economic inequities that we live in. And we've certainly seen this in London with an added concern for the homeless. That eventually has got to be reflected in architecture. And whether you're building sleeping porches, because you want more fresh air, whether you're ensuring that more bedrooms have windows that open and shut, that there's more space for people to live in, and repurposing domestic homes with that in mind. And then reflect that to what we were starting to learn in COVID-19, where as Anisha was pointing out, so many more people are working from home. And what are the implications there? I think a lot of houses have been designed with fairly small living spaces, and now children are having to do their homework in those spaces, and they may not be adequate. They may not be acoustically sufficiently separated for children and adults all to be working at the same time online in their houses, with still adequate communal spaces to go to. We have to also think about the implications for multi-generational homes, which are not unusual in Canada, which are often not adequate in terms of the space that different generations require. And that also, I've often wondered how people quarantine at home. I mean, how many homes really have adequate separation of sleeping and washroom facilities that don't have to be used by other members of the family so that they can safely quarantine them? These are the kind of questions I think that architects have got to think about in designing new domestic spaces. As for the redesign of workplaces, that's also been the case in terms of considering ventilation, the spaces of whether you're going to working in a large room or within cubicles or within offices and with more people working at home. I think there are huge implications there for new architecture. And then surely there's going to be the question of how you redesign and repurpose old architecture to keep in mind these new human needs and the future needs, and also keeping in mind the iniquities. And I think we come back to the iniquities that we've been thinking about this so much in London when we realize how difficult it has been to cope with the homelessness and how important it is to deal with homelessness. So I think that's something very much that's going to take the time of architects, municipal officials, politicians. One thing I think, maybe to go back to the kind of rejoicing that David feels is going to happen when things open up again and we can all go back to artistic spaces and museums and theaters and concerts and so forth, is how fortunate we have been in London with the public spaces that we can go to within COVID. And I'm thinking about the amazing park structure that we have in this city, that we have on the whole, we have very safe streets. And this is where we've been bumping elbows with people and talking across, the 6 feet of separation and within and outside of the masks. And we are extremely fortunate to have that. But that's because we're a small city with with three branches of the river flowing through it. And we've got an awful lot of great public space. I think architects are going to be thinking about that. And I hope that it's going to be a subject for politicians and for the people who vote for them. So these are big issues. So I hope that answers some questions. I think in my mind, it raises so many more.
Right. Absolutely. No, but that's so telling. I think you're absolutely right, whether it's your porch or your bathroom or, whether you have enough room for kids and adults working, it just comes down to where you are and, what your environment is and what privileges you have. Right. Yes. Thank you so much, Shelley. We're going to go to Dr. Datta to just elaborate a little bit more on this. We're talking about the inequality of the current pandemic. So what can governments or organizations or, even each one of us do to help mitigate the pandemic's, disproportionate impact on certain populations, for example, new immigrants?
Yeah, so again, no point repeating, but not only about with this pandemic, but any kind of global level catastrophes, right, have disproportionate income on different groups, right? Sometimes based on biology, as I was trying to tell you earlier, but also based on structural factors such as, class position, and homelessness, for example, somebody without a shelter, or even the kind of work they are in and all that, right? Now, the most recently collected and distributed reliable data source on whether what kind of impact pandemic has brought in on new immigrants and visible minority, right, comes from the data that was released from Stats Canada in October 2020. So I was quickly, I was looking at it yesterday, and just to read out some highlight points here, it shows that immigrants who are mostly engaged in essential service work, new immigrants, and work such as long-term care homes, they face the double jeopardy of not only health risk and economic risk, but if you look at different incidents that have been happening in and around Canada or even in North US, because of all those conspiracy theories, some groups, especially groups from China, right, people belonging, having Chinese, South Korean, or East Asian ancestry, right, they have been victims of, harassment, stigmatization, and, sometimes violence, right? So, like some horrible incidents that happened in, in Vancouver and all that, right? So, so this is the third jeopardy, right? Just one highlight, for example, it was the data released in October 2020 shows immigrants are disproportionately represented in jobs with greater exposure to COVID-19. So 34% of frontline and essential service workers identify as visible minorities compared with 21% in other sectors, right? And they are also involved in, they are engaged in other such industries such as, hospitality and accommodation, right? Again, the exposure risk is higher, right? Health risk. On top of that, what has also been seen that the other problem is, though they are aware that, they have higher exposure and they have to do something, historically it has been seen that sometimes when it comes to uptaking the vaccine, they do not so much get into getting the vaccine, right? Readily take the vaccine. Now there are historical reasons because of that. Perhaps our historians know about African Americans in the US, what happened with testing syphilis and all that on them. So sometimes there are suspicions, low trust with the government, but. Given all these situations, first of all, one point that I would like to, a few steps that I would like to, recommend here, and I would like to suggest here is, first of all, there are no race-based data on COVID-19 at this point, right? So that's a big recommendation, so that we can see. And if you know the history of immigration in Canada for the last many decades, mostly, immigration is happening from continents such as Africa and Asia and Latin America, and people who are new immigrants now are mostly, they can be seen as belonging to racialized background status, right? Racialized minority, or sometimes in StatsCan official language, they are called visible minority, right? So if that is the case, and they are working in those kind of essential services, one thing that, in a democratic country like ours, we should perhaps ask our policymakers, our legislators, people who are into lawmaking, and our government, that they should ask these kind of work environments, right? Long-term care facilities, or retails, or grocery shop, groceries, that there should be progressive human resource environment, right? Again, I don't want to repeat issues such as living wage, benefits, paid sick leave, and all that, so that it becomes when you are not when people who are in low paid jobs, when they are forced to come to work, that has happened with meatpacking industries in Midwest USA and also in some certain parts of Canada, they are coming sick, right? And they might be carrying the virus or something else, and they are spreading it all around. So it actually becomes also a public health concern, right? Secondly, the other thing is, when it comes to, again, economic risk, new immigrants, ultimately, when they're coming from a different country with not enough, wealth base and all that, one way, and if you again look at the history of Canada's housing market, is one sure way to accumulate wealth is to buy a property, right? Whatever, a small and medium-sized or whatever. Now we know that in this condition, even though people are losing jobs, there is SARB and this and that, house prices are skyrocketing. In London, just 2 days back, the report from CBC said the average house price is now 607,000. Can you imagine, right? So think about it. Some new immigrants who are, maybe they are without Canadian, academic credentials, so they are forced to get into those kind of essential service, low-paid jobs, or they are trying to again, get recertified, going to school and all that. Plus, they might have families and all that. So they can never perhaps afford, buying a small place and all that, right? So the gap that was closing between new immigrants and Canadian citizens, right, that might increase. That's also the prediction based on this research from StatsCan. So one policy level, action that government can do, and we can perhaps ask and debate about this, is there should be more social housing projects targeting them, right, dedicated to them, right? And the other issue is health risk factors, right? Since they are in essential service jobs, think about, our PSWs and nurse aides, right? These for-profit companies, right, who run these long-term care homes, they shouldn't cut corners, right? About, amount of PPEs they are distributing, right? Whether they are distributing high quality masks and all that, right? Remember, for the last 1 year, we have been reading all these kind of investigative reports about long-term care homes, right? So that is another way to reduce their health risk, right? The other thing that is a long-standing demand, many of these low wage earners, not only limited to our new immigrants, but also our Canadian low wage earners, right? They often do not have medical insurance that would help them pay their prescription, filling their prescription, right? Prescriptions. So sometimes they have to struggle between whether I'm going to pay for housing, hydro, food bills, or do I have to fill my prescriptions, right? So there is a long-standing demand, right, from certain groups in our society in Canada that there should be a universal drug plan, right? So that essential, essential medicines, right, and they are in hundreds, they can be covered. The other important thing, and I take the cue from England, that research shows that new immigrants are often hesitant to take vaccine, right? Sometimes lack of trust, sometimes maybe lack of education or less belief in science. I don't know. There are various factors, right? It's hard to pinpoint on one, but our politicians, our healthcare, policymakers, they can, collaborate with community level network, right? They can, invite community leaders, and so that, new immigrants, right, can be vaccinated at a faster rate, and because again, they are into essential service, right? So it's a risk for everybody, right? The example comes from England, that where mosques have been playing an active role in vaccinating Muslim, visitors to those mosques, right? And they feel more confident. So that can be a cue, right? Using community level network. And lastly, I would like to point out about the issue of, race-based, skin color-based, or how you look, whether you look Chinese or Korean, right? And that might not be only about new immigrants, right? There can be a person who is third generation Canadian, but that person is Chinese Canadian, right? So there have been attacks, right? Stigmatization, harassment, abuses thrown at them and all that. So I think, of course, BLM has made people very much aware about racialization, race issues. But I think government should take some kind of proactive communication strategy to counteract a conspiracy theory about, the vaccine is originating at only one point, and so these people, should be avoided, should be, you should, show hatred towards them, right? And also our police force, right? They should be made, made more aware, educated, so that, even when they are policing this kind of hate crimes, they have more progressive attitude, right? They should be on the side of, justice and fairness, right? Not to, exacerbate, those kind of hate-based violence and all that. So I would like to just, outline these 3 or 4 points.
Sorry, yeah, it's so important, and I'm so glad you hit on so many of those points, especially with the vaccination, because we know that's going to be the next stage, hopefully for all of us. So I want to turn to you, Dr. McAlister. You have an interesting perspective on mass vaccinations, being both a surgeon and a researcher of medical history. So, do you think that we've got a bit of an unrealistic expectation for our COVID-19 shots, and especially the timeline for those shots based on, you know, previous vaccination campaigns and creation?
Well, Megan, that would depend on what your expectation is. I don't know if any of us online here are vaccinated, and if there's any prospect of us being vaccinated in the near future. So if that's your expectation, you're going to get that met for sure. If we don't look, of course, to the 1918 pandemic as the model for vaccination, but we do have some good ones in the past. The polio situation in the 1950s is a very good model. And there's a story from 1961 where Japan had been isolated but was suddenly overwhelmed with polio. The Sabin vaccine was just available, and they started a mass vaccination program in 1961 in southern Japan, and they eliminated polio virtually. I mean, maybe I'm exaggerating there, but they more or less turned that thing right off all in 1 year. And that should be our expectation. So I think when we go back on this, we're not going to be too kind on certain people. In the 1980s, we privatized some of our public facilities that were making vaccines, and that decision has come back to haunt us terribly. You know, vaccination and our medicines are actually matters of national security, and that's clear now to people, and we should have been looking at them in that way. And the Americans are very quick to do it. You know, they say, this is a matter of national security. I don't care if you're our best friend Canadian, you're not getting it until every single American is vaccinated. And, you know, we're maybe too nice or something about it, but this deference to private firms is ridiculous. And we're not going to be very pleased about it in the future. The second thing was, have these private firms actually behaved and performed according to expectations? I doubt we're going to be very kind to them either. I don't know how the CEO of the major, I won't name firms, but you all know who it is, planned a routine upgrade of the facility that was making the world's vaccine at the very time we need it. That fella shouldn't have lasted a week in my book. If he was the manager of a football team, he wouldn't even be given his jersey on the way home. But he's still there, and he's still promoting his own firm first. So that's not going to look good. Manitoba has just started a negotiation to actually test the new vaccine from Calgary and then use it. You know, we're not going to be very pleased about why we didn't do any trials of vaccines in Canada. I was dying for them just to say, we're going to pick, I'd even take the Russian vaccine, to be quite honest. It's not a bad vaccine. It's probably better than the AstraZeneca because it's two vaccines. I don't know if you know that. They use two different vaccines to boost the second time. It's probably going to come out as a decent vaccine. But why didn't we make a deal with the vaccine teams to test these vaccines? We had healthcare workers, all of whom would have lined up for that vaccine. We normally recruit 2 to 1. So 2 would be vaccinated, would get vaccinations for every 1 in control. And we would have had 2/3 of our healthcare workers vaccinated last year. And then we'd only have to vaccinate the 1/3 who were in the trial afterwards. Anyway, these are questions that we're going to ask later. So if your expectations are like mine, that we're not going to be vaccinated till end of the year, they're probably going to meet that. Now, I don't want to sound like putting out alarms there. For all of these hiccups that have occurred, there are going to be compensatory surges in vaccination. So we're going to see a boost in the availability of vaccine from Pfizer and Moderna in about a month. And a lot of people are going to get vaccinated then. And we might even drift into that situation, like you mentioned, for 2009, if the levels of disease go down, the prevalence of the virus goes down, and a lot of people are already vaccinated, people will just shrug their shoulders and say, well, maybe I'll get vaccinated, maybe I won't get vaccinated. And I hesitate. We're all talking about lessons learned. The big lesson for me from 1918 is that our ability to forget is dramatic. They never talked about the vaccine for 70 years after, talked about the pandemic for 70 years after it, until Hilary and other historians took it on as a topic. Very recently, Hilary, really, in comparison. If I could go back to that topic just for one thing about lessons learned on it, it was fascinating that in 1918, influenza was not considered on the list of quarantinable diseases because it was a new disease, allegedly, to them. Actually, we had multiple flu pandemics going back into the 19th century, and they knew well about flu, but we didn't include it on our list of quarantinable diseases. The other thing that quarantinable diseases only applied to foreigners. It didn't apply to Canadians coming home. So we had problems with soldiers coming back that obviously had been in contact with influenza, but they weren't considered for quarantine. And without the help of a Surgeon General called Carleton Jones, who had been disgraced in a kind of a political fight that went on in England, and he'd been sent home, and he was the most senior military medical officer, and he was a quarantine officer prior to joining the military. He realized this problem, and he quarantined the ships himself as the senior military medical officer and said, don't let them land, keep them on the ship until I sort this out. He had to go find the public health director who was missing at the time, but he found him and they negotiated, and he said, okay, we'll put influenza on the list of quarantinable diseases. At the end of the pandemic, we made our federal Department of Health. Prior to that, we never had one. And we never really defined what the role of the Department of Health, the Federal Department of Health, is. We still haven't figured it out 100 years later. They're allegedly meant to be responsible for communicable diseases and on our borders and communicable diseases, but in fact, the provinces are the ones that have been acting probably more in dealing with the pandemic than the federal government, although it has changed a little bit in that regard. But anyway, long answer to say that we probably forget about this pandemic and leave a lot of problems in the future. I think let's not panic too much about the vaccine. We will get vaccinated, and towards the end of the year, we won't care anymore.
Let's hope. We're crossing our fingers. But, I think it's such an interesting point too, right? What stays with us, and what are we able to forget and just move on from, right? And that leads to our next question, which is for Dr. McKellar. When we talk about these past public health protocols, or learned a new acronym from you, it was the public health interventions, the PHIs. How did they impact populations, especially young children? And what does that tell us about what we might be facing in the coming years because of our PHIs this time?
NPIs, non-pharmaceutical interventions, NPIs. But you're right, Megan, you're right. Past public health protocols did impact populations. And an example that everyone wants to talk about from history is, did they close schools in the past? And what kind of impact did that have on kids? And we know that during the 1918 flu pandemic, that many schools were closed from anywhere between 1 week to 3 months, depending on where you were in Canada. But I'm so glad that Dr. McAlister brought up the polio epidemic Everyone overlooks the polio epidemic. The polio vaccine story is wonderful, and Paul Martin Sr., what he does for Canada and staying the course to keep Canadians in that clinical trial in 1954-55 is so key story. But I'm going to talk about polio outbreaks in terms of school delayed openings. Because as you know, the polio season is late summer to early fall. So polio seems to hit from July to October. So when there was a polio outbreak, there's lots of discussion about let's just delay opening schools until the polio passes. And in 1937, there was a particularly severe polio outbreak in Ontario as well as elsewhere. And in 1937, we closed schools and remote learning for kids comes into play. 1937. So in 1937 in the US, there was this large scale radio school experiment. And there's lovely pictures of this. The Associated Press puts them out in the newspapers of all these young kids lying on the floor around the large radio with their notebooks and pencils in hand. And in that same year, 1937, the Toronto Daily Star, the Toronto Globe and Mail, they started publishing lessons for high school students in their papers because the high schools were closed and teachers were made available to their students by telephone if students needed them. So the school closings are interested on that level, but what I find really interesting is the debate in 1937 about whether we should close schools or not. So should these kids be kept at home or were they really better off at school? Now, 1937, there's no talk about kids' mental health, but there was this talk about, well, kids are falling behind in their studies. They're bored at home and parents are just attempting to keep their kids busy. Wouldn't they just be better in schools? And this is what's happening in Toronto. And I'm taking this work from a colleague, an historian, Tara Abram at the University of Guelph. And Tara Abram's done some work on this. And she looked at 1937 as a particularly bad year for polio outbreaks. And in 1937 in Toronto, so the Toronto schools were set to open on September 1st, but given the severity of the polio epidemic, the Toronto's medical officer of health at that time, a man by the name of Gordon Jackson, decided we should put off opening the schools for a couple weeks. And then closer to the date, he decides to delay the school opening again. So he pushes back kind of the dates and he pushes it back until about October 12th, which is 6 weeks later than originally planned. Sound familiar? Delay, 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 right? But there's debate about this, if he's doing the right thing. So across Canada, several municipal health officers actually felt that this is the wrong call. The schools should remain open. And in Ontario, our chief officer of health at the time was John McKellar, and he said, kids should be in school. I mean, they could have proper medical inspection there. We've got the watchful eyes of teachers and nurses were in schools at that time, even doctors. And really, wouldn't children be safer in the schools and being at home, roaming around the streets? Because there was no kind of stay inside order, stay at home kind of order. So there was criticisms about keeping kids out of school. So why no schools? Why are we closing the schools if kids are just able to go out in the streets and play? Poor Toronto mayor. I mean, he's caught over a barrel on this, right? So the Toronto mayor at this time was a guy by the name of William Robbins. And he actually stands up for the decision to close the schools. And he says, quote, they can catch up on their lessons, but you can't restore a child, end quote, right? So you've got all this we're protecting our kids. And I think Tara Abrams does some great work on this. And I think she rightly points out that it's hard to compare 1937 scenario and dealing with polio outbreaks with our current COVID-19 situation. She points out some obvious differences, notably the length of time that we're keeping our schools closed is a big one, right? So we're talking about a matter of just somewhere between 2 and 6 weeks for the polio epidemics, but now we're much beyond that in 2020, 2021. But what I like about the comparison and why I like to use it in my teaching is that you really get a sense of fear and confusion, and you get different voices and different sides. So you get some parents who are not alarmed about the schools reopening, and they felt that their kids are going to be just as safe in the school system or even safer than keeping them at home. And then you've got other parents who are very concerned, and they're glad that the public pools are closed and the theaters are closed and schools won't be opening, and they're keeping their kids inside. They're keeping them away from playing with other kids, and they're very worried. And then you also have the kids' voice. Apparently, in 1937, kids were eager to go to school. I miss my friends, and I'm not keen on this home study business. Remember, this is 1937. And I do agree with Tara Abrams when she talks about the sources of anxieties are different. So in 1937, what parents are fearing is they're really fearing, their anxiety and fears is all about the disease of polio. Will my kid catch it or not? Will they become paralyzed or not? Could they potentially die or not? And I think in 2020, 2021, parents are less anxious about their kids contracting COVID-19 than they are about the stress and anxiety about balancing their work, their jobs, working at home themselves, homeschooling their kids. So I think the school closings are affecting us differently if you do a comparison, kind of the lessons learned. And I agree with Dr. McAlister, kind of lessons learned we tend to forget, but I also think we can fall into false analogies too. So we have to be careful in kind of how we're using history in that way. I think in both 2020 and probably 1937, what we see with parents and kids and the spotlighting of this closing schools, remote learning, is that everybody has individual experiences, and it's hard to put everybody together in kind of one lump experience. What will be the long-lasting effects of this? We don't know from the short excerpts of the past, but I do think that the individualized experiences means that the effects will vary. And Dr. Datta can probably talk about this, that sociologists will be studying this, and they'll find that there's not really a homogeneous cohort experience of stunted learning or deficiency. And I think, as Hilary's pointed out, Dr. Datta's pointed out, about this idea of inequities is going to come in play, and it's going to be interwoven into that experience, and that's going to affect the outcome of it. But I really do believe that that's going to be on the studied in the future by sociologists, this particular cohort that's going through this remote learning, whether it be elementary or high school, or even the university students now, and they're going to be carefully watched over the next several years about what that impact's going to be.
That's so
Can I
good.
jump in to add a point in this regard?
Sure, we're racing the clock here, but
Yeah,
let's hear
okay.
it.
Yeah, I was reading some research related to this, that in Bronx, kids belonging to backgrounds, right? They are really struggling with online learning because of lack of broadband or lack of enough number of laptops. Whereas if you belong to an affluent family, you can easily take virtual piano lessons and tennis lessons, right? So there lies the disparity.
It's
I'll
so
stop
true.
here.
It's so true. Thank you both for that. So helpful. So as I say, we're just racing through the last one. So hang with us if you're at home. Two really good questions. We're going to pass it over to Dr. Vance next. And similar to the idea of our lasting impacts here, Dr. Vance, but in your perspective and in your research, what do you find about how long our public panic or our public paranoia lasts after a pandemic or after a big health crisis?
Well, that's a really good question, Megan. I've crunched the numbers, and I could say it's going to be 5 weeks, 7 days, and 3 hours, give or take 20 minutes. Then we'll be clear of it all. Yeah, it's an unanswerable question because there are so many factors. Shelley talked about the medical end and the social end. There are so many factors involved in both of those elements. Are we going to have more new variants? Are the vaccines going to work? Will there be another wave? Whatever. What I would say is that the panic will subside, but it's probably never going to disappear entirely. I think what we're going to see is our baseline is going to change, if you like. And maybe we want to think about, use the analogy of someone's resting heartbeat. So if our normal social stress level before COVID was a 0, in time we'll return to what we think is normal, but our normal social stress level will maybe be a 1 or a 2. So we're not going to go back to the way we were in terms of an absence of panic, possibly ever. I think we're gonna see for quite a long time the existence of a couple of extended responses, what you might call the "it's happening again" syndrome, the realization that we're hyper aware of what might occur because we've lived through it already. Or maybe we'll get something you might call the "what's next" syndrome, I'm sure you're stunned by my use of psychological terminology here, the what's next syndrome. The sense that, oh, we've had COVID now, so let's just wait for the next catastrophe to fall upon us. So we might get those reactions, or as a bunch of people have said, maybe we'll have this kind of remarkable amnesia, and it'll slip from our minds naturally. But I think because of this experience, we're going to be more likely to panic more quickly the next time something like this comes along. And as everyone who knows anything about the subject has said, this is not an if, this is a when. We have to accept that and get used to it. I think the best defense for our collective mentality is to be aware of that fact going forward and not to let it rule our lives. I'm sure everyone's heard the phrase age of anxiety, whether it's the long poem by Auden or the novel by Pete Townsend or any number of books by historians. Is COVID ushering in a new age of anxiety? I would actually argue that all of human existence forever has been an age of anxiety. And that the emotions that we are collectively experiencing or have collectively experienced over the last year are not new. We have heard time and time again the word unprecedented. In fact, none of this is unprecedented. That's why sometimes it's a real drag being a historian, because you see how often things repeat themselves. And when I was teaching my zombie apocalypse course a year ago now, just as COVID was breaking and the pandemic was upon us, I actually was able to lecture on things and then have them occur in the community in real time thereafter. And it was great because it really made me look like, sound like I knew what I was talking about for once, which was fabulous. But I could show the students time and time again how everything they were seeing in the community had happened before in various different contexts, various different pandemics or other kinds of panics. So anyone who has studied the history of panics, there were no surprises. Everything is exactly what you expected it to be, from panic buying to scapegoating to officials running off and thinking the regulations don't apply to them. So I think to deal with our long-term kind of anxiety, we have to realize that we have seen this all before, human society, and we'll see it all again. This is our future repeating itself. And what we need to do is minimize, if we want to minimize our tendency to panic, we've got to resist the hyperbole of thinking that everything is unprecedented. Don't buy into the alarmism that this experience is in any way unique. We as a species have been through this before, and we got through it. We will go through it again in the future, and we're going to get through it again. So if you take the long-term view, it has a way of bringing a kind of peaceful equanimity to your soul, if you like. Equal
parts comforting and depressing, I would say.
Hey, that's what I'm here for. Comfort and depression. That's my shtick.
My goodness. Oh, it's so interesting though. I try to stop saying unprecedented anyway, and now I really need to. So we're a little bit over time here. We've got one last question, and it's for David. We want to look towards the future now. What innovations do you think museums or other cultural institutions will need to adopt in order to bring people back post-COVID?
I promise I'll take less time than I'm allotted, but I do want a quick addition to Shelley's great talk, and that's the effect on pandemic-born babies and new mothers. The lack of interaction with other babies and new mothers, there's got to be negative implications there. Innovations and what museums and cultural groups can do to bring people back. When this first started and we started doing some new things, my line was never waste a good pandemic. There has been a decade of innovation across all sectors from 1 year of pandemic. And cultural groups, first and foremost, must leave their old paradigms behind. The trick is to not try to aspire to what we had, but we need to build something better. And again, that goes for all sectors, I believe. I do also think that hybrids will surface because of the pandemic. We recently partnered with Desire to Learn, a local tech company here in Waterloo Region, the Brightspace platform you may be familiar with. And that now allows us to deliver education programs virtually, both across our region and the province and literally around the world. And it's sort of a duh moment. We should have thought of that. We didn't need the pandemic, but it has inspired us to do that. We also learned doing that without the expense of yellow school buses and part-time staff, our online curriculum is much more profitable. And that's an interesting thing for a not-for-profit to understand. But we need to balance that with in-person learning. So a hybrid, may well be in our future, and perhaps there's a premium for in-person school trips, or alternatively a discount for online. But point being, there would be a hybrid, and we would offer both going forward. That will allow us to reach new audiences, and for the museum, one of our strategies is to evolve our brand globally and have a digital strategy so we can have people participate in our programs from other countries. And it's a huge new opportunity that was there, we just hadn't identified it. Another example of duh was, why didn't we think of this before the pandemic, was that for 3 weeks beginning at Thanksgiving weekend, we hosted a drive-through dinosaur experience with robotic dinosaurs for pandemic-stressed families who, from the safety of their car, saw these creatures. In 3 weeks, we hosted at an off-site location 50,000 paying people, customers, or half of our annual attendance in 3 weeks. I think museums need to continue to consider how to engage their audiences at their preferences and at the person's preference, in person, online, off-site. It's a whole new world for us to engage people. And so our museum has been offering virtual programming throughout the pandemic, and now our need is to evolve that to monetize it more. And our task is, which I've given to our young team, is to monetize 30% of our offering this fiscal. And we are making these investments because we now know we can reach a much wider audience than our old paradigm suggested. And thank you for inviting me. It's been really great. I appreciate all the speakers. So thank you very, very much for including me.
Thank you so much, David. Wow. Well, half annual attendance, that is definitely, don't waste a good pandemic, eh? I have some thank yous to give out tonight, and most especially to all of you. So much amazing knowledge in our virtual room here, and truly, I feel like I have to go scribble down a list of story ideas like right after this, because so much to think about. So thank you all for being here and for sharing your expertise so generously, including 10 minutes after our time, because I talk too much. I will take the blame. So sorry, everybody. Thank you so much to everybody at home too, who tuned in on the Facebook Live, or if you're tuning in later in a replay version. We're so grateful that you're able to share in this as well. So the London Heritage Council would also like to thank the City of London's Culture Office for their support putting on this event. So happy to be able to share this night with all of you. I will let you all go and stand up, move around, stay safe. Absolutely. Don't waste a good pandemic, as David would say. And we hope that we'll see you all in person next year for the 10th Annual Heritage Fair.
Thank you.
Thank you.